Greetings again, this is Dr. Wyatt, and this is the first case of these women that had TMJ pain, and every one of them's condyle was bugging the retrodiscal tissue and causing this pain really, heck, it hurts like the dickens. People don't think about it until they have it, but it is very painful if it gets really bad like this. Now this lady I'm bringing up here is a young lady about 20-something years old. She was going to college, and her father had a dairy, and he got sick, and she had to go milk about 40 cows in the morning and 40 in the afternoon and do her college work and do other things. And this just burdened her down, and she came down with this jaw joint problem, and nobody seemed to find out or try to help get it out of there, and it is amazing. Dentists run from this. These videos are not popular at all. They just don't pay much attention. They think they can get away with it, but you're going to have a lot more people in here, and you should examine everybody you start to work on and see if they do have a TMJ problem before you start. And I'll have a case after we get through this showing you exactly about that. Let's get into this now. This lady was about 20-something years old, a very nice looking young lady. No problem at all with the profile or anything in here. Blue eyes, blonde hair. And the lady from California called me, and she didn't remember her name, but when she told her about the milking the cows, I remembered the case, and I looked it up. And she, I think, was living in Wichita Falls when she was doing this and going to school at North Texas, I believe. That's the way. And she's serious right here. But when she smiles, she has beautiful teeth, a beautiful smile, everything, but she was having a dickens of pain. Now, the way we got her out, you take the condyle and you bring it forward. In other words, you have the person sitting where they're sitting in a chair in a normal head-to-shoulder relationship. And people make these things to fit between the teeth, and you push the head back like this. You see that the jaw pushed back this way. But when you come forward, the jaw comes down as you get out here. Your chewing like this, with the little teeth out in front or back behind. And you don't want to make anything to fit the person except in the normal position of the condyle, of the head on the shoulders, just sitting there like I'm sitting here now. And now you can check and see where the jaw wants to go in there, and then you move your jaw forward, and you'll come to a point that is comfortable, and that's where you should make your splint you put in there. Now, what a splint does, it has a ramp on it. I'm going to get up here where I can mark on this good, and your lower teeth hit here, and they can't close back there. They have to slide up here to close in this position. And as long as they close up here, the condyle is out here, and it's not pushing into this sore tissue that the people, like this lady says, she'd been hurting for 25 years. I don't know how on earth she did this. And I tried to explain this to her, and I think she's going to fly over here, and I'll have to go to the office where I used to work, and there's a young lady working there, not so young now. She's been working for me all of her life, and she's a hygienist now, and she's made splints for me for years, and she'll go to this Dr. Mike Whirley is where she's working, and he has helped and kind of saved our practice. I had to retire about 75. My wife said she was going to retire whether I did or not. And so I gave the practice to Dr. Mike Whirley. And I was going to work over there about a couple of years and show him some things. And I ended up working for him for about 12 years. And I'll use the name of the lady that was working for me, was Patricia Smith. And she came to work when she was 16 years old, and she worked her whole life with me, and she still worked with me, with the Dr. Whirley after I retired and left. Now, so I'm going to send this lady back. If she wants to fly over here and get somebody to do it, I'll get Dr. Whirley to do this, and Patricia will probably make her another splint or whatever it is. But this is a forward positioning splint. Pulls the teeth about here, but you got to have something to close the teeth. If you just pull the teeth up here, you bite with your front teeth, then all the force is on the back teeth. But you bit the splint, puts material between the teeth here. And so now in the daytime, somebody running around with something like that in their mouth, that just, you can't take that. But you got to sleep in it and wear it around the house as much as you possibly can. And don't let the jaw go back and irritate that tissue. And usually the tissue will heal up and get over it. And then you can figure out what you've got to do. Some of them you have to fix the teeth where they won't go back like that. Now on this lady, we use a lower splint down here. And I think this is one like Dr. Holt used. You know, you can wear that in the daytime, and your teeth fit together. They lock into these tracks up here, and that holds it there. But normally we would make a splint with a very small ramp that would hold the jaw forward, but they could get behind the ramp. But in the daytime, you don't do that. You hold your jaw into the position up there. But at night, you got to have something big, and you cannot go behind it. If you get behind it and bite down, it pushes your jaw even back further and give you a whale of a lot of pain and everything. So this is, you try to make this ramp where they can't bring their jaw back. They can't get behind the ramp. And once in a while, people will get behind it. You haven't got it big enough, or the ramp high enough, and they chew back here. That pushes the jaw back so that gives them a real fit. All right, here is the lower deal, and here we put this lady in there. That's the lower one while she's wearing it, and there's the upper and the lower splint together, and she wore that, and we could keep her jaw in this position. But you got to have something under these teeth when you bring it out there like that. And so when she wore the splint and kept it, even though she was stressed with the working the cattle and the dairy and everything else, we got rid of the problem back in the jaw. She had a minor problem, but then you stick stress on top of it, and then that double problem breaks the person down. I mean, they're going to have this pain like that. So here we've got her, that's where her face, we held her teeth together for that position, but we had this splint that filled in this gap out here. It had to be out this far. Now that took care of her pain. And some way or another, this young lady, of course, is not young now. I don't know how many years old it was when we did this exactly, but it's been several years ago. And that was the lower arch is holding that out. And here we're working with, this is 1995. We had to come in and advance the mandible a little bit up the upper arch, and then the lower arch could come out and close, and that solved the problem. You can get rid of the splint if you position the teeth where they are comfortable and make the teeth fit there like that. And that's the problem that this lady from California is going to have to do. I feel that's what's going to hurt. Well, here we advanced her mandible, and she's got a little bit of overbite, but it's not very far off right here. And she's got some material between the teeth here, so that when she bites, the force is not just here and back on the condyle, but it'll hit and come out on the material you have between the teeth and the splint. All right, there's the lower arch she wore during the daytime, and here is the one she wore at night, and the lower teeth fit right in here. This is a shorter ramp. We make one. Sometimes we make them a couple of times. Have a ramp that they could get along with in the daytime, and that pulls it forward up here and holds it, while the TMJ problem back here, the swollen, irritated tissue, heals up and gets over it. And that's solved this young lady's problem. There's the ramp that we put on a kind of a retainer-like thing. After we got her teeth erupted together, we could take this part off, but kept the ramp that she could wear like that, kept the teeth in that position. But we had the teeth coming in contact, taking the load, and not having the fossa back in the back taking that load. And there we pull that back, and a lot of times you let the teeth, we bite and take the load here, and then these teeth come together back here. Then you can depend on them taking the load and not the condyle and the fossa back here taking the load. And it would hold it where these teeth come together back. And that's why we come out of the disc, and we've got to bring the teeth back where they interdigitate in a better position. But we did that and finished her up in '95. And there's what she's wearing one. And she probably kept that with that small ramp where she would sleep in that every night. And she could take it out in the daytime, and we bonded, put something on the bottom to take the load while we let the upper back teeth come together. When they come together good, you could take this off. They take the load, then these teeth will erupt here together on both sides of the mouth. All right, there was the pictures we took, the transcranial x-ray here. And the condyle is sitting in the fossa right here, and this is this is the ear, and the brain is right up in there. If you get jammed in here, it'll knock this disc completely out here in front, a real hard blow will, and it'll knock the person out because it's real close to the brain structure there. Now there is the split, and that's open part of the way. And here it is, open as wide as she could. Now sometimes the jaw will close up in here, and the fossa wants to be in this part, and you got it out here, and boy, they can't close. And like that, and they'll come in. If you catch the jaw and push down on the back of it, and then push it back, in other words, push this, put pressure, pull this down, and then shove it back in here, and let it come up underneath there. That'll take care of that. Now there it is, back in the place. That's the other side of the mouth. And it's open by, now there it is, it's just, she can close with it at that position. Now this is the teeth coming together. These are the clasp on that lower deal. I don't usually make that. I just make another upper one and bring the teeth out to that. So here was the thing with the splint in the mouth. You got I think the lower one is in place. It's putting pressure in here. It doesn't let this take the pressure. If you don't, this takes the pressure, and it goes from here to here, and that puts too much pressure back in this area, and that'll cause more trouble than you have. And everybody that messes around with teeth ought to understand about how the human jaw works and how this fossa works right in here. And there's the way she goes. And we got it where in that position she had no pain at all, yet she was still milking the cows and taking care of her father, who had gotten sick and everything. A very nice daughter. Now there we were wearing this, and we let these teeth come back in contact. When they get to take the load, then you can take this off up here. That's the way we come out of it. In other words, you come out of the fossa, the splint, where you don't have to wear the splint all the rest of your life. Of course, you can wear the splint. Now here's a nighttime one, and here's a daytime one, see? So we didn't use the lower one all the time. We went up above, and that makes you bring your jaw up here, and you're awake, and you realize if you try to close back here, you bring your jaw over here, this will make you close, and you get where you just close there automatically. All right, there it is. It's closing out here. We've got the lower one on the box, and it fills in here, and then you're going to let these come together back in the back. There he is after we finish it, and this is 3/17 of 95, and she's 21 years and 5 months old at this point. And there we're finishing it up. Well, that's 96. We had the braces still on there. And there it is, 8 of 96. I thought we took her out earlier than that. There's that deal. We took it off on one side, and that we'll chew over there, and then take this one off later on. And that's much of the pictures that I've got on this lady, but we took care of the TMJ pain that was brought about by stress and real tension. She had a small TMJ jaw position problem, and we corrected that and took her out of that, and she worked all right fine. And somewhere or another, this has been years ago, 95 or 6 or 7 in there somewhere, but she and this lady in California got in contact, and the lady called me and said she needs her teeth taken care of like this. So thank you for watching, and I'll go on another one of these in just a little bit. Thank you.